Today we're performing doctor's ABCD on this patient. So first D, we're going to check if there's any danger around us to me, the victim, or any other bystanders. And if there is, then we'll have to move the danger away or move the patient away from the danger. And then next is R, which is response. So if the patient is unconscious, to test if he's unconscious, we're going to try ask him some questions, ask him to squeeze our hand or open his eyes. If he's not responsive, then we're going to send for help. So we'll call 000 and get an ambulance to come here as soon as possible, but I'll ask a bystander to do it so I can stay with the patient. Then next we're going to check the airways, so we're going to put the patient into the recovery position so that they're breathing fine, yep, there. And then once the airways once they're on the side into the recovery position, they'll be breathing normally, or their airways will be open, and then now we can check if they're breathing properly. So we'll look, listen and feel if they're breathing. So for look, we'll look if their stomach's rising and falling, or their chest is, and then we'll listen to hear if we can hear any flow of breaths coming in, and we'll also feel if we can feel any air going onto our cheek when we do that. And then if they are breathing, then we'll lead them into recovery position and keep checking if they're responsive before the ambulance arrives. If they're not breathing, then we're going to have to start performing CPR. So we'll have to CPR. So CPR, you do 15 for 15 seconds. You do 30 compressions, so about 2 compressions each second. And then after that, you do 2 breaths, and then keep repeating until the ambulance arrives. If they're not breathing, then you also can use a defibrillator, but because we don't have one, you have to just do CPR until help arrives. So you do 30 compressions. And 2 breaths. And again. Two breaths. Two breaths. Yep.
He's alive.